A woman walked into my office one day who sat down, started crying, and said, Dr. Sandler, how do your children with leukemia do here in the United States? So I told her about, at that time, 60% or 65% of all children are cured. And she said, in Mongolia, none of them are cured. And what can you do to help? So that sort of started the relationship. Then in 2012, I had a patient here at the hospital in Jacksonville who had leukemia, and his name was Jonathan. And Jonathan loved to travel, and one of the places he really wanted to go to was Mongolia. And in his memory, his parents started a small foundation to try and help with these educational missions, and so that's how it really got started.
I'm a pediatric intensivist. I'm also a Nigerian. I come from a country where if a child is in severe respiratory distress, the child is in respiratory failure, they don't have the capacity and the resources to intubate and mechanically ventilate these children. What we are doing is that we're trying to establish the first organized pediatric ICU in Nigeria.
3 or 4 years ago, we were down visiting Machu Picchu as part of a sort of an offshoot of a conference trip. And I kind of fell in love with the area. And I came back with the idea, sort of the naive idea, hey, we're gonna go down and do a mission. We're gonna do pediatric nephrology, maybe a little pediatric urology. They had some grants up here as part of the International Medicine Program. We were able to get some money to go down. And it was an incredible experience. It was better than I could have imagined.
So Missions for Life, and with Nemours DuPont's global health outreach, I've organized trips to the beautiful little town in central Mexico in the Sierra Madre Mountains of San Miguel de Allende. Our focus is primarily pediatric. Primarily we look to do health screenings and health checks for the children and to do any type of interventions that basically where they need referrals to a medical facility.
So we went down, we were in Samoa for probably about 10 days. So I brought a resident with me. The resident wanted to see how ophthalmology was practiced in kind of resource poor settings and learn some surgical skills that can only really be done there.
So we spend a week at the hospital consulting on patients, giving lectures, and just providing a lot of information. And then we put together supportive care guidelines together. So for children with leukemia, now over 50% of their children look like are cured or long-term survivors, which is a far cry from 0% in 2012. It is redefined for me what I think are the things that I want to accomplish in my career. When you have the opportunity to help improve the system for a whole country's worth of children, that's a very dramatic difference, and it's really exciting to be able to do that.
So the goal of this trip that we went were twofold. One, we targeted to build the skeletal structure of the pediatric ICU. It's a 5-bed pediatric ICU. I had an A-team. We have 4 doctors, 4 pediatric ICU nurses, and 2 respiratory therapists. The aim was, because there is no subspecialty as pediatric critical care in Nigeria, we wanted to look at the different areas that they needed training for. We needed to train the doctors, we needed to train the nurses, we needed to train personnel that can do respiratory care. And that's what we did while we were there. Nemours, the global outreach program at Nemours, has given us every single support that we need.
I think what impressed me the most was watching the expertise and the precision of all of our docs and our nurses and our residents, and the curiosity that they had.
The amazing thing about being down there is that these are patients, this is sometimes their first kind of chance to meet a doctor or to have some kind of medical care. What I really liked about the trip is I was able to educate the doctors on 2 or 3 basic diagnoses that they felt, by the end of the time I was there, they felt comfortable making that diagnosis. What I'd really like to do is be able to establish this sort of as a clinic that works very closely with Nemours.
To have Nemours come on board and say, hey, we like what you're doing and we would like to help support you in those efforts. I've been floored by all that. Over the last 7 years, I've taken well over 100 people to San Miguel, but it never ever gets old.
I was in the operating room in the mornings, and then in the afternoon I was in the clinic for all of the work days we were there. It gives you an appreciation for kind of what we have here and the luxuries we're afforded in medicine here.
If you want to join us, I would encourage you to join us. If you have any ideas, if you have any vision of any sort of global health project that you would like to do, what I would say is just start. Don't procrastinate anymore. Talk to people. Talk to me. Talk to people who have done this. We'll give you ideas. The good thing too is that Nemours has put into effect a structure that will support anyone that has a viable project. So you have everything that it will take to help you to initiate your project and see your vision come into fruition.
If you want to experience something as a team, if you want to be able to have an experience where that altruistic side of you is having a chance to really blossom, then I would participate in an opportunity like this.
There's plenty of opportunities for us to connect with surgeons, with doctors, with social work, with child life, to clinical staff coming down and helping with data input. So pretty much everybody can come who works at Nemours.
So a lot of us think about refilling our tank when we're on vacation or on the beach. This was an experience where I think myself and the team also got to refill their tank while doing what we do best.
But no matter how you do it, I think you'd never regret it.
I think it is a tremendous opportunity for Nemours. So not only does it give us a voice in helping children everywhere, which is really our mission, but it gives us an opportunity for Nemours to really make that difference, and for our physicians and staff to see what medical care is and could be in other places. Everybody who's gone is ready to go again.